So, welcome everyone. I am Dr. Nicole Kmack. I am a licensed clinical psychologist, and I am president and CEO of Black Mental Wellness. And I am happy to invite you all to Freedom to Heal, improving mental health access and reducing recidivism through community support and healing. At Black Mental Wellness, part of what we do, we're passionate about talking about mental health through a Black perspective. We are a team of four licensed clinical psychologists, and part of how we do that work is one through creating resources and information about mental health from a Black perspective. We also have a national training program where we work with mentees. We have mentors, we have mentees, ambassadors, and we also have agreements with schools such as Morgan State University, where we have practicum experiences and internships. And really, our goal is how do we diversify the field? And part of doing that is through providing these types of learning opportunities and connections. And so today, we will be going through a topic, and I'll introduce the student because I'm working with a student from Morgan State. I'll just throw her in here now, but I'm working with Jessica Gilliam. She is a doctor in the doctoral of public health program at Morgan State University, and she's currently completing a field placement with Black mental wellness. And part of her work has really been about merging the world. She worked with justice involved individuals and really saw some gaps in the field of the work that she does and really wanted to think about now what do we do as it relates to these mental health challenges. And so today, this is sort of like a culmination of all the things that she's been working on. So I'm so happy to see it all come together. So she planned the event, she came up with the topic, she selected the speakers, and she will be our moderator for the evening. And so we have some objectives and things that we really want to cover today, which you can see on the screen. I'll go through it quickly. And then, did you want to do this part?
It's fine. Hi, everyone. I am Jessica Gilliam, as Dr. Kamen said. Today's discussion may include sensitive topics such as incarceration, trauma, substance use, mental health, and suicide. Please take care of yourself throughout the program. You are welcome to step away if needed at any time. And some of the objectives that we will go over throughout this discussion will be identifying common mental health concerns experienced by returning citizens, explaining how unmet mental health needs may affect successful reentry and increase the risk of recidivism, describe systemic, social, and individual barriers that limit access to mental health services, and lastly, identify strategies that promote healing, resilience, access to care, and long-term mental wellness. Today's conversation will explore how mental health services, community support, and stronger systems of care can help returning citizens achieve stability, resilience, and long-term wellness. Um, All right, so our panelists today, we have Dr. Henry. She's a licensed clinical psychologist and correctional mental health leader. She provides clinical oversight for two male correctional facilities and specializes in trauma-informed, culturally responsive mental health care. We have Dr. Jennings, a licensed clinical professional counselor and public health professional. She's the founder of AJ Counseling and Consultant with expertise in mental wellness, resilience, burnout prevention, and sustainable well-being. And then we have Dr. Rice, a criminal justice professor, researcher, and community partner. He brings more than 25 years of experience in criminal justice, corrections, community partnership, violence prevention, and family services. All right. And thank you again, panelists, for being here today. We can jump right in. Dr. Henry, I would like to begin by helping our audience understand mental health needs commonly experienced among incarcerated and the formerly incarcerated population. What are most prevalent mental health conditions you see among incarcerated and formerly incarcerated populations?
Hi, Jessica. Thank you so much um, for this conversation. It's really important. And I think it's important to recognize that correctional facilities have become one of the largest providers of mental health care in the country. And that's largely because many individuals enter the justice system with untreated behavioral health needs. What we know is that Black youth in general are more likely to be, or less likely to be referred for mental health services through their schools versus in comparison to their white counterparts. So they're less likely to receive them early on. They're more likely to first encounter mental health services through the juvenile justice systems or when they get incarcerated. And so what we see is that the most common conditions tend to include a range of different things, like that include like major depressive disorder, as well as anxiety disorders, especially the trauma and stress related disorders like PTSD. A lot of kids enter into the system having come from just a range of different homes, whether it's from foster care systems or had disruptions in placements and due to neglect or just a range of had a lot of different child adversity experiences. Substance use disorders, which frequently co-occur with mental illnesses. We see bipolar disorder as a common diagnosis as well. A lot of people go untreated for so many years. Schizophrenia and other psychotic disorders, as well as personality disorders, as that is related to individuals with extensive criminal justice involvement. And so, one thing I've always emphasized is that many individuals don't present with a single diagnosis. They often have co occurring mental illnesses that include, again, like I said, substance use disorder, chronic trauma exposure, unstable housing histories, and significant medical conditions. And they overlap. These like overlapping conditions tend to require more of an integrated treatment rather than treating each issue in isolation. So oftentimes we'll have someone treating someone for substance use, but they're not getting at the mental health aspects like the depression and things that tend to co-occur. And so often the question isn't simply like, what is the diagnosis? It's what happened to this person and what support was missing before they even entered into the system that actually put them into the system.
Thank you for sharing that, Dr. Henry. Dr. Jennings, building on that, can you discuss the emotional and psychological challenges that may arise as individuals return to the community?
Yes, and thank you also for putting this panel together tonight. This is a very much needed conversation. And so when we're looking at individuals who are just being released, some of those challenges that we may often see, we may see like some hypervigilance, them kind of like looking over their shoulder a bit, some anxiety, definitely some difficulty just acclimating overall into society. I just want to give a quick example. I remember, when I was working with an individual a few years ago, and they had been incarcerated for over, I believe, 2 decades. And so just looking at that time period, someone who has been incarcerated for over 2 decades, over 20 years, and then coming back into society, it's a huge, significant learning curve. You know, there's internet. Oh, there's, cell phones. And oh, okay, there's no longer typing up a resume and handing out your resume to jobs. You have to go online and submit it. You have to create an email. So there's a big thing where people have difficulty just getting like reacclimated like back into society. Of course, trying to navigate those relationships that they may have lost, with family, with partners, and certainly with their children. Even just talking about trauma in of itself, a lot of these individuals may have experienced trauma prior going to, jail or prison, but then being in institutionalized place also creates even more trauma. And so someone coming out, navigating all of those things, then on top of that, lots of shame, guilt, just feeling even stigmatized, difficulty finding a job, difficulty finding housing. All of these factors just kind of play a part and they serve as huge challenges for someone that's just re-entering back into society.
Yes, that is a very important part, especially regarding like the community support and building the
Mhm.
relationships with family or their friends, community, and then also just the different barriers that they face when being
Right,
released.
right.
Um, our next question, Dr. Rice, um, what unique role can colleges and universities, especially HBCUs, play in supporting returning citizens and justice-involved communities?
So I think that universities can play an important role in terms of policy, research, and practice. One of the things that universities can do is conducting meaningful and impactful research in the community as well as behind the walls in order to get a better understanding of the impact of the incarceration experience. One of the things that Dr. Henry touched upon that I appreciated was this focus on disparities. And I would also offer differential treatment in terms of looking at persons of color, particularly Black persons in the system, in comparison to their white counterparts, not just locally, but also nationally. So understanding those disparities and how it impacts mental health treatment, I think, is key. Also, universities are in a unique position, particularly HBCUs historically, to be a safe place to convene, to increase awareness and understanding of the issue and the challenges that justice-involved individuals face. Dr. Jennings talked about some of those experiences. One of my colleagues and good friend, Kevin Sherd, he's an author and social activist, and he has a book called A Life for a Life. And Kevin had done many years in federal prison, and he talked about in that book an experience of a young man who committed a heinous crime, who had many mental health issues that were later diagnosed. But he also talked about how when he was released and he thought he was okay, there was trauma that he had experienced by witnessing homicides in the community firsthand, but also witnessing and being part of violent acts within the facility. And so that experience, I think, is something that's important. And so universities have an opportunity to increase scholars' awareness and understanding, as well as the community's awareness and understanding through summits, convenings that happen at a safe place such as a HBCU. And also in terms of policy, sometimes things happen at different levels where the community may say, well, what does this mean for us? And I think scholars are in a unique position to be able to translate some of these policies and break it down into practical pieces so that justice involved individuals understand how these policies could impact services or the lack thereof, but also how students, as well as faculty and the broader community, can advocate and push the needle. And so while universities can, through our interdisciplinary curriculum, train and prepare students and scholars in the community to work better with justice involved individuals, I think it's very important that we have a safe place in order for this work to occur. And so HBCUs historically have been a convener. And the last thing I will add to that, at our university, we have a health clinic that is free to the community. We have a daycare center at Coppin State University. It's free, not free to the community, but I think it's a sliding scale. But we have resources as an anchor institution on campus, the type of resources that when justice involved individuals transition back out into the community, many who may not have health care or some of the support services, even though may be limited in a prison, they may not have those returning back. And so HBCUs that are connected to community-based providers, which we are, can also make meaningful referrals and also provide resources and support, not just to that justice involved individual, but also to that family. Because as many of us know, meeting basic needs is one of the major issues that is on the mind of many justice involved individuals when they transition out.
Thank you, Dr. Rice. So now that we've discussed the broader roles of mental health, community reintegration, and academic institutions, I would like to explore how incarceration and trauma may affect individuals during the reentry process. Dr. Henry, how does incarceration impact the individual's mental health and adjustment upon release?
Yeah, I think everyone has highlighted that already. It's a great question, but I think Dr. Jennings as well as Dr. Rice have highlighted, incarceration itself can significantly affect mental health, right? For a number of reasons. First, a lot of the individuals entering into the criminal justice system, the justice involved individuals, they already come from, they may have seen a lot of trauma, but they see significantly more trauma within the justice system. So for me, I worked in maximum security prisons. And so there's a lot of crime. I mean, there's a lot of crime and violence, right? People are having to survive in there. So what I've been a part of institutions, prisons where, there's homicides that occur regularly. People are about to get out of prison. They after serving 15 years, 5 days before they're released, they're killed. Or they witness a killing. They're witnessing their bunkmates stabbed. They're witnessing sexual assaults. I've had offenders who will never walk out of prison the same as what they entered in. Maybe they've had bleach or been burned. I'm sorry to be harsh, but the reality is that they're raped, they're beaten, they're tied. They're experiencing significant trauma in these settings, so they will never be the same. And so I continuously encourage them to continue to get the mental health service upon their release. These individuals are experiencing prolonged separation from family. On top of that, they're experiencing, again, the chronic stress, the hypervigilance, like Dr. Jennings said, the exposure to violence, the isolation, the uncertainty of the future, right? While we want to say that freedom and going back out into the world in the prison I'm in, we call it, in the prison system, we call it the free world. Going back into the free world might feel like freedom to some. They don't know. They're struggling with the adjustment piece of it. So even individuals without a prior mental health diagnosis, if I haven't made this point clear enough, may develop symptoms of anxiety, depression, sleep disturbances, trauma related reactions while incarcerated. And so upon release, many of these individuals experience what we sometimes refer to as institutional adjustment challenges. So they're expected, like, again, we all continue to say, to navigate all these different real world experiences like employment, housing, transportation, healthcare, all of the things, reintegrating with their family while also managing their mental health. That's a huge task to put on them. And so the first several weeks after release are especially critical, like other populations, like the veteran populations, once transitioning back into civilization. So research consistently shows that there's elevated risks for psychiatric crisis, substance use, relapse, overdose during that transition period. So again, while release is often referred to or viewed as freedom, we cannot look at it like that. It's a stressful transition that requires a lot of significant support. So we have to be mindful of the needs and making sure that they're connected.
Thank you, Dr. Henry, for that. And I know you mentioned that they face other barriers such as employment, housing, while having to deal with mental health. So, what best practices do you think reentry programs can implement to ensure the continuity of mental health services after release, or to help them just reintegrate back into society?
Yeah, so successful reentry starts before release, not after. But again, we got to look at the systemic barriers that are put into place. And unfortunately, I always say, like, while we want to say, okay, beginning discharge planning months before release is very important. It's not realistic when you're dealing with staff shortages. I worked at one of the most dangerous prisons in the state of Georgia, right? Where we had over almost 1,000 justice involved individuals on the caseload. At one point, almost 1,000. Where at our worst, we were in a state of emergency. You had one clinical director, that was myself. We had one mental health unit manager, and we had one mental health clinician for over a caseload of 1,000 people. Do you think we had time or the opportunity to make sure everyone was getting the proper paperwork or care? When we got to being fully staffed, we were still short, right? We were still at 9 or 10 mental health counselors. They're in charge of also trying to get them the release document. It would be great if they can get the documentation for release the day before. But we know that it starts months before. That's how they can get successfully integrated. So scheduling that community mental health appointments before the individual leaves the custody, but also ensuring that there's like this warm handoff between the community clinician, I mean the correctional clinician, as well as the community-based clinician. Again, but we have so many barriers in place that keeps that from happening in a lot of situations. Ensuring that Medicaid or insurance is activated before they're released. That's not always the case. Unfortunately, they're released without insurance. Providing an adequate care supply of psychiatric medications. And just addressing all of their, again, what we continue to say, their housing needs, their employment, transportation, food security issues. And in some prisons, yes, they are doing it months in advance when they have their case managers and can do it. I was talking to an offender today. I'm sorry, a JII today. And what happened was he's planning on getting out in January. They're already connected with him. That is a great opportunity when that can occur. That does not occur in most facilities where there are staff shortages, unfortunately.
And thank you, Dr. Henry. Dr. Rice, what gaps currently exist between criminal justice systems and mental health service providers?
So I think, of course, and I think the understanding of this concept, and I'm hearing more of this, terminology, post-incarceration syndrome, PICS, and it kind of encompasses a lot of the challenges that were mentioned pre and post release for justice involved individuals. And I think I would say that, and just kind of stepping back, um, some of my experiences, working, early in my career, I worked as an addictions counselor at Patuxent, and I saw some of the challenges that the justice involved individuals were facing behind bars. And I think my colleague just noted that. But one of the things that I just want to pause the uplift here, and not to deviate from the question, but it's this issue around stigma. And there's, in some instances, resources aren't connected to individuals who need them because of the stigma around mental illness, right? Stigma around substance abuse. And then when you look at the issue of masculinity and the correctional system, and how that is viewed by some men, that can also, and women, in terms of being tough and not being able to ask for help. Some individuals, if they're in a culture and a climate where there are dedicated people on the treatment side, in as well as out, they may be more comfortable, right? But at their initial assessment, and when they transition and get classified, that may be missed, right? And of course, as my colleague mentioned earlier on the panel, that, you know, unfortunately, many people are overworked. And so even if you're in an environment where people overworked, they may move on in a short span of time. They may do great work, but move on. And so I think that creates a gap in terms of continuity of treatment. So if someone develops a great relationship with Dr. Henry or Dr. Rice, and maybe they're HIV positive, maybe they were traumatized and molested as a child, and they confide in us, and Dr. Henry or Dr. Rice moves on for another opportunity, they may say, I'm not sharing this with anybody else. I don't have the energy to establish that kind of trust. And so there's stigma issues, there's trust issues. And I think that it's important through education, awareness, and training, and also leadership being invested to ensure that those gaps that are there are addressed, that could impact a smooth transition for those who are moving from the correctional facility, be it prison or jails, back into our society.
Thank you, Dr. Rice, especially speaking on the building the trust. I would like to, Dr. Jennings, to elaborate on that, and how can mental health professionals build trust and provide trauma-informed, culturally responsive care to individuals who may be hesitant to seek support, just building on that stigma and trust that's involved with mental health.
Yeah, well, I think first of all, you definitely have to understand that, those who are justice involved. And thank you for that updated language as well, because I was not aware. But for those who are justice involved, you have to understand that hesitancy kind of comes with the package, right? As we've all have been sharing on the panel and talking about the clients, excuse me, these individuals' experiences. Trauma, is at the heart of it. Anxiety is at the heart of it. Substance use, mental health, all the things, these are all significant factors that are influencing, why they may be hesitant in wanting to build rapport, or why they may be hesitant in wanting to even establish care with a mental health professional outside of, post-release. It's just important for us as mental health clinicians just to keep that door open, right? Keep the rapport going, and making sure that in doing so that we are prioritizing like their psychological safety. We want to make sure that we are slow to build the trust with them. We want to make sure, of course, to not use any type of judgmental language. We want to be very transparent about the process. We want to be very I wouldn't say hands-on, but kind of hands-on, treating them with the utmost care and respect, just making sure that they're feeling safe so that they can eventually start to lower their guard and that they can eventually start to engage, in the therapeutic process.
Okay, thank you, Dr. Jennings. Also, what practical strategies can help formerly incarcerated individuals manage stress and just support overall long-term mental wellness?
So I would definitely say making sure that they are involved or getting involved with a mental health professional. That is key. Getting involved with a mental health professional is going to help you create or help you establish, I should say, really good coping skills, right? Really good, healthy coping skills. Learning how to manage your emotional wellness as well. Helping to establish practical routines, um, you know, making sure that, they are doing things in a structured way, because unfortunately they have been living life in a structured way, but also we know that providing structure is very helpful and is also very useful to helping like build resilience and build that self-confidence that they need. We want to also kind of make sure that they are aware of their triggers. Um, Triggers are not just for individuals who are abusing substances, but your triggers to, well, if I was unfortunately, locked up because of anger issues, I want to be aware of what are my triggers, that could possibly lead me down that road, to doing something that I would possibly regret and send me back to prison or jail. So we want to kind of do those things with them. And then, of course, also, this is all like an ongoing process. And so we want to help them practice self-compassion. Self-compassion looks like um, being gentle with yourself, reframing some of that negative self-talk, to more encouraging and positive self-talk. I'd like to say, what would you tell your child, if your child was in a situation, what are some things that you would tell your child, or what would you tell your best friend? That same type of hopefully good-natured, support and advice is the same thing that you could be telling yourself as you're navigating this new process.
Yeah, can I add to that? And I
Mhm.
think Dr. Jennings made some excellent points and observations. You know, here in Baltimore, we have organizations such as Druid Heights Community Development Corps, Center for Urban Families, ROCA Baltimore. Some of these organizations, such as ROCA, use cognitive behavioral therapy to work with justice involved individuals, just as Dr. Jennings touched on, to think before they act and to kind of run through how do you manage your emotions, how do you make informed and decisions, not impulsive decisions, and be really critical thinkers, right? And so I think that that's a good thing that we're seeing. But also, the University System of Maryland includes several schools that are at the table, some who have prison education programs. And prison education programs are critical because, again, in terms of a person's optimism and outlook, what will my future, do I have a future? What will my future look like? And by being able to take college credits and move towards a certificate in entrepreneurship or degree, that helps instill a sense of pride and hope, right? And so, if we're talking about this, coming into this space from a humanistic lens or humanistic approach, that aspect of hope isn't corny, but is something important that can also connect with the trust that the service providers create, but also helps them when they may not feel like being compliant with their medicine or may not feel like being compliant and coming to group therapy or individual therapy. It's the hope that the optimism and the opportunities through prison education programs, through cognitive behavioral therapy, and through positioning a supportive village of people, be it family, friends, as well as providers, that can ensure the person, the justice involved individual, has a strong shot at success.
I also want to piggyback on that just as well. Creating and building upon the hope, and also like making sure that this whole process is a collaborative process, right? Because when you are in prison or when you are in jail, you have those decisions made for you. You have your autonomy kind of stripped away from you. But when you are reintegrating back into society, we want to make sure, just from a mental health perspective, from public health perspective, from just even a community's perspective, that when we are offering services, and whatever services that they are, that we are offering collaboration and that we're offering choice, and this is not something that you have to do. This is not something that you should do, but more like, what would you like to do, or how would this look for you, some things like that. We want to make sure that it's a choice for them and that it's a collaborative effort.
Thank you, Dr. Rice and Dr. Jennings. And from my day-to-day work, what I've noticed also that helps is peer support specialists really helps individuals when reintegrating back into society, and just being mentored by someone that's been through what they've been through. It gives a different outlook. How do you guys see this in the work that you guys do on a daily? Like,
And you said, how do we see it showing up?
yes, in the work that you do on a daily.
Um, Regarding the mental health needs, the reintegration.
Yes.
Yes, I think everyone highlighted great points. And just to add on to what Dr. Rice was saying about CBT. So, CBT is really a great intervention as well to reduce recidivism, because in regards to how targeting not just changing their thoughts, but it's like really targeting their criminal thinking patterns and emotional regulation specifically. So if we think about our justice involved individuals, and when you are in a maximum or a high maximum security prison, whether or not you've engaged in criminal behaviors before you came to prison or not, you were wrongly incarcerated, you will eventually learn how to survive. It's the survival of the fittest. So your thought patterns start to change. And so when you're re-entering back into the community, it's really important that you do utilize treatment services to change that thinking. Like 6 months ago, I met with a justice involved individual who stated that, after 20 years, he's about to get back, he's about to re-enter into the community. He was fearful, he was scared about it. But he was mostly fearful because he said, what I began to do in prison to survive, how I got by, how I made money in prison, I can't do the same things when I get released. So it's having to really work with them and be aware that, you have to start those changes earlier on. And so I started working with him on thinking about what are the small changes he can make now to not have to just make those changes once he integrates into the community so that he can start having that preparation time. And so I see it a lot. I see a lot of what we're talking about. The trauma is evident. I think it's important that we really be more mindful of the trauma that these individuals experience, especially when we're thinking about interventions. So while we want to say that they should have a lot of these interventions in the prison system, it's hard to really prepare them as much. There's a lot of barriers that we experience in the prison system that is hard to implement. I implemented the very first EMDR clinic in the state of Georgia, in my prison. And so that's to be able to provide a high quality based trauma informed treatment. But it's hard because one minute the JIIs are there, but the truth is the next day they can transition out and transfer to a new prison. And we're not notified. I can't be notified. The offender can't be, the JII can't be notified of it. So it's just like there's different barriers that come into play. So there's a lot of barriers within the system that prevents us from really doing the real work that we try to do.
Thank you, Dr. Henry. And do you mind like elaborating on MDR
It's
and
a
how it's helpful?
Yeah, it's eye movement desensitization and reprocessing treatment. It's a very effective form of trauma treatment that is found to be very effective and efficient in a shorter amount of time. It's not just talk therapy, but it's neurobiological, so it works on the brain. It utilizes bilateral stimulation. So whatever you do to one side, a lot of people can do eye movement, but you can do tapping. So whatever you do to one side of your body, you do to the next. It's an effective way to speed up the rate in which you process. A lot of people have started out in the last like probably 10, 15 years or so. It's really effective for anxiety, trauma, all forms of treatment, but it's a quicker way to process trauma versus talk therapy where it speeds up the process. It allows us to get at our core beliefs, the things that we haven't been able to process. And it's highly effective and it's worked in probably all cases, but it's a form of treatment that our prison population doesn't have access to, which is unfortunate. So, historically, you could get access to EMDR if you were paying out of pocket. Nowadays, you have more EMDR trained therapists who are insurance, who accept insurance. Like I accept insurance, and so it was one of those treatments that was hard to reach. But I believe that, and my belief is that everyone should have access to the highest quality of treatment services.
Is there a reason why it's not accessible in prisons right now?
You have a lot. So one of the issues that I have that we have in the prison system is who is likely to work in rural Georgia, right? When you think about the way the prison system is structured and designed, they're all in rural areas. So when you think about those who are trained in certain areas, they're usually not, you don't have a lot of EMDR trained or specialty. Sometimes you don't have a lot of the best clinicians in the prison system. Fortunately, I was able to start it and I was able to recruit someone who went to EMDR training with me to come on as my clinician when I was working in the area of Georgia that I worked in. And I recruited her from Tennessee. The area of Georgia that I worked in, it was Tennessee, Alabama. So I was able to recruit some of the highest or best trained in these different regions. And so I was able to get someone on who was trained in EMDR. But you're not going to have you're going to have shortages of staff, and who you get is slim pickings when it comes
Yeah.
to who can provide the services.
Yeah. That's unfortunate, but it's a reality. Yeah.
Okay, thank you, Dr. Henry. What role can families, community organizations, communities, and other support systems play in promoting healing and successful reentry, and also just reducing the stigma among justice-involved individuals in mental health?
Well, I'll go back to the aspect of providing a safe space. So, Druid Heights Development Corp and their ex-offender program, they have a men's rap session that takes place, I believe, twice a month, and it's dialogue circle fashion, and it gives justice involved men an opportunity to be able to de-stress, but also share some of the issues that or challenges that they're experiencing, but not just the negative, but also positive. You know, the wins, the successes, successful experiences that they're having. That can also be encouraging to others who are a part of the group, but also it allows the team at Druid Heights to be able to get a understanding of what some of the particular needs may be of the men in that group. One of the things I think community-based organizations can do in partnering with universities, particularly HBCUs, is to provide the space in the community and on campus for listening sessions, to be able to take a position that those who are most affected by some of the challenges and be it personal, professional, that they're having, that they can play a role in the solution. And I think it goes back to some of the empowerment and autonomy. Now, I don't say that without, I don't say that with in the perspective of eliminating accountability, right? Many providers have an expectation that the investment and the resources that they provide will be utilized in a way that is of benefit to the justice involved individual. But I think that there are opportunities to conduct needs assessment, because remember, from COVID to shifting policy to shifting federal funding, this impacting organizations that support justice involved individuals, new trends that are happening that can impact their mental health. We have to be able to, as a broader society, pivot, adjust, and also vision cast so that we can not only meet the needs as they exit the facility, right? But also thinking about what does the future look like, not just short term, but long term, and what are those things that need to be in place. And so again, I think that communities, Department of Public Safety, Correctional Services, and universities can play a key role in ensuring that that there are opportunities for successful reintegration based on the collaborative efforts.
Thank you, Dr. Rice, for that. I just have one last question for everyone, and that is, what is one change you would most like to see in the future to improve mental health support for justice-involved individuals?
I would like to see a higher quality of care. I would like to see more money put into policies, practices, and procedures just put into place in terms of making sure that we have the staffing, the financial support that goes into the prison system, and the justice system in general. Again, we have a large population that is individuals who are in need of mental health care, but we lack the support. I currently work as a staff psychologist after leaving as a clinical director. I now work as a staff psychologist in 2 different prisons, just 2 days a week part-time. And both of the prisons are severely short-staffed, to where a lot of the offenders, the justice involved individuals on the mental health caseload, are not accessing care or services. So I would say that we need to put more money into the resources that goes into the prison system.
Same. That's actually what I was gonna kind of say, just more support and money put towards having more licensed clinicians in the prison systems to really help and support those who are justice involved.
I would add, and I concur with my fellow panelists as well, but I would also add that I truly believe that individuals, justice involved individuals, they have to, of course, do some work, but I think society also has to do some work. So if my cousin who is justice involved has been released and he's having an episode and I call for help, it shouldn't be an expectation that when law enforcement arrives that it's just a criminal call, right? It has to be some greater training, awareness, and understanding that maybe this is a mental health call, right? And so I think more training on the law enforcement side, more training on the court side, more training on the community side, and enhanced training in facilities. I think those are some things that can also fight against the stigma. And also, we have to continue to educate our scholars to push back against this attitude of, well, if they're in jail, hey, it is what it is. Why should I care? And so these are individuals who will come back into the community and reintegrate. And so we have to ask ourselves, do we want them to reintegrate in a way that adds to the community, or do we want them to reintegrate in a way that they're not successful, but it's also adverse to the community, adverse to their family, adverse to our community?
Thank you, Dr. Rice, Dr. Jennings, and Dr. Henry. So now we'll open the chat up to the audience for any questions.
I'm sorry, did you say the chat or can we speak?
Oh, yes, you're welcome to speak as well.
Okay, good evening, everyone. My name is Edward Roberts. I have been justice impacted, struggled with substance abuse for over 20 years. I recently opened a sober living home in Elizabeth, New Jersey. I am a business owner. I have 2 businesses, 10 employees, real estate owner. And I am one who has had the same trauma and challenges as many of those behind the wall. I didn't do a lot of time, but I had the invisible bars around me because of my mental status, because of what the environment shaped me to be. I'm a peer recovery specialist, and I appreciate the comment that was made because I think it's very important that they see people and interact with those who actually overcame some of the same barriers that they will face. The reason I started the sober living home because of my weekly visits to Kentucky and to the prison was just not enough. 1 hour a week was not enough to help change or transform someone's mind. And I believe that mindset is our biggest challenge. We are our biggest enemy. And being involved, having certain situations, traumatic experiences shape us, but it doesn't mean that's who we are. So, the idea of getting into the prison is a great idea, but I believe that the system itself would not allow that because the system itself is designed to keep us exactly where they want us to be. So I see I can get more value by spending time and having weekly meetings with my guys and going over Every Step Counts book that I created and another prison ministry person created And the first thing we do is focus on self-awareness, and bringing consciousness to the behaviors. I'm not a therapist. I go to therapy. I take a lot of my things that I've learned through therapy and support groups and bring it to my community to make them more aware of what they're dealing with and what we dealt with living in the underprivileged environment. And it's not just about the lack of finances, it's the lack of resources, it's the lack of parenting, missing parents, and missing father, especially for the men, where we gravitate to the environment around us. So I just want to the question, what can be done? I think it's important that we highlight those who and show them this could be done, and the steps that needs to happen. The technical side is I, I applaud the therapist. My therapist is great, but my transparency with these guys helped them as well, right? And I'm not at the mountaintop. I'm still struggle with behaviors, whether it's overeating. I'm still getting coached in every aspect of life, whether it's at a gym, my finances, right? My marriage counselor, like we deal with real stuff. And I think it's just important that these guys know and women know that they're not alone, and we share real life experiences with them. So I just wanted to say that I'll put my, because I need you guys as well. I don't have the letters behind my name, but I am an expert in my own experience. So I went from a GED, and that's what I have. But I have some other certifications, and I'm no different than that guys that's in there. I lead guys who did 20 years in jail, and they look up to me because I'm like them. And we hold meetings weekly at my office, and it's group therapy in a way. It's group therapy, and I just wanted to share that because I want to partner with those who don't. I don't have everything. I don't know all of the therapeutic things that you guys study, but I do have what I have, and I know if there's a collaborative effort, we can get more done with saving our community. So I just wanted to put that out there. Thank you.
Thank you for so much for sharing your experience. Thank you for the work that you do as well.
Yeah, and I would just say, good brother, continue to stay encouraged and do the great work. You're modeling the professionalism that others will see and inspire them to want to do the same, right, in their own unique way. And so, they say iron sharpens iron, and it sounds like you're doing your work. And so I appreciate you being candid and sharing that as well.
Thank you. And if I could just add, it's important that holistically we address these men and women um, outside of the, providing jobs. I'm a business owner. I just took 2 more certifications so I can add different skill sets to my environment, but also the spiritual part. Like I can't leave that part out. It doesn't happen without whatever your choice of spirit is. You can't do it. And just for me, whether a person is Eastern philosophy, whether they are a Christian, which I am, if they're into Islam, I encourage to have a connection with the divine because I know that is a key to success. And everyone may not believe in it, but I can only tell you what works for me and those who are around me who I see successful. And so holistic plan is what I look at to make sure that on our journey to wholeness that we address every part of the individual, not just the skill set, not just the mental health, not just the spiritual health, not just the mental health, not just their financial health, but all of it together because we are a whole person, right? we are we not just one part, right? Mind, body, and spirit. We have all of that we need to tend to, and it's been neglected for so long. So it's just important that we address all of that. Thank you.
Thank you.
Are there any more questions, comments?
Well, that was so powerful. Thank you all for sharing your expertise. One of the things when Jessica and I were, well, she's doing the heavy planning. I just asked the questions to help her plan. One of the things that we talked about is that we wanted the voice of someone who had been involved with the system for this program. And I love how things just come together because we still ended up with that and being able to share your perspective and your experiences and also your work. Part of what we believe truly at Black Mental Wellness, and Dr. Henry had to get off, but she's one of the co-founders of Black Mental Wellness, is that lived experiences come with their own level of expertise. And so when you talk about, like, I don't have these things, you don't have to have it. You have the lived experience and being able to use that. And I think, Jessica, as you were talking about what do we need to do and how do we make these changes, that is a part of how we do it, like having all the voices at the table, because you study something in one way, you lived it in another, and it's going to take bringing it all together to see some of that true change, both when people are in and as they're integrating out. So I'm so glad it all worked out. It always does the way it's supposed to. And thanks for coming off camera and sharing your perspective and your experiences. This has been great. It's a topic that is near and dear to many of us on Black mental wellness for various reasons. And so thank you, Jessica, for bringing this vision to life and finding our panelists today. We recorded the event. We're going to cut out the beginning because, we had a little whatever. But we will send out the recording to all of you. So if there are parts that you missed, you will be able to capture it. And then as we have the link for the evaluation. So this is also part of Jessica's work. As I mentioned, she is in a doctoral program of public health. So not only did she develop this program, but she's also been doing some program evaluation and really looking at what does the data say and how can we use that to continue to improve programs and bring things that people want and that you need. So we ask that you complete the evaluation. And then from a Black mental wellness perspective, we have these are programs that we do that's free to the community because we want to bring these mental health topics to the community. So we have a lineup of things that'll be coming between August and October. And then in November, we have our seventh annual Black Mental Wellness Conference. This year, the theme is healing across generations because we truly believe in the healing in the Black community across generations and that there is something we can learn from each other. And that will be on Friday, November 6th in Silver Spring. And so we have these types of conversations. And in fact, we also have a panel that's called Lived Experiences, where there's only people on that panel with lived experiences, not the experts, because again, we want to always provide space for all of our voices as we think about mental health and wellness. And so I am so happy. Thank you all for showing up tonight. And again, I'll send out some emails. I'll also send out the evaluation so that we can get some responses for Jessica. And thank you all so much.
Thank you.
Yes, good night.
Thank you. Good
Thank
night.
you.